occupational therapist at St. Boniface Hospital. I will be reviewing energy conservation, sleep hygiene, stress management, and quality of life for patients with heart failure. So what is energy conservation? Energy conservation is learning to find a balance between work, rest, and leisure so that the energy demand on your body is reduced. When a balance is created, the strain on your heart and symptoms such as tiredness and shortness of breath are reduced. Over time, you can build strength that can allow you to participate in daily activities. Just like batteries, we all only have a certain amount of energy to expend every day. Let's use that energy wisely. The 4 P's are important to keep in mind when thinking about energy conservation. These P's include prioritize, plan, pace, and position. The first P is prioritize. You may want to make a list on a paper, computer, or phone to help guide what you need to do. Next, you can identify tasks in order of importance. Placing numbers beside activities on your list can help in the prioritization process. This will help to clarify what needs to be done now and what can wait. When your list of to-dos is long, ask if others can help you. Planning is the second P and is an important part of energy conservation. There are several factors to consider when planning your day. Plan your steps so you avoid making extra trips. Make sure you are alternating between lighter loads and heavier loads. This will give your heart a chance to recover in between. Use a calendar to outline your plan for the week. This will help you to avoid having 2 heavier days back to back. Build in time for rest. Having a workspace with items within easy reach is beneficial in improving efficiency. The third P is pacing. It is important to avoid rushing. Maintaining a slow and steady pace prevents potential errors and extra stress on your heart. Even if something doesn't go right and you feel stressed, remember to keep your breathing slow and regular. Do not hold your breath. How you feel is key to what is happening in your heart. Slow down, take a break, or ask someone for help if you are short of breath, tired, or feel your heart is speeding up. Always remember to rest before you are tired. The fourth P is positioning. Good, upright posture helps to get more oxygen into the lungs and throughout the body. Whenever possible, avoid bending and reaching, as this results in extra work for your heart. This could lead to more fatigue and shortness of breath. Sitting saves 25% of your energy in comparison to standing. If you can adapt some tasks to complete them in sitting, this can have a positive impact in your overall energy levels. Practical tips can help you feel more organized, conserve energy, and provide more time to do things that you enjoy. Bulk meal preparation involves making a larger quantity of food and freezing it in smaller containers for future use. Lighter weight pots and pans can be easier on sore joints. If you have a number of items to take to the basement, organize them in smaller, manageable loads. Adaptive equipment such as a bath seat for showering or a long-handled shoehorn or reacher can make daily activities easier. A calendar or weekly schedule is helpful in keeping you organized. Recognize times of increased stress and illness. Your body will need extra rest to recover. Birthday parties, holidays, and other special occasions are important times in life. Plan for this by getting extra rest the day before. Sleep hygiene refers to habits that promote quality sleep. Things like relaxing before you go to bed and having a regular sleep schedule are good sleep habits. Try putting extra pillows under your head if you are having difficulty breathing when sleeping. If you are waking up often at night to go to the bathroom, let your healthcare provider know. Sometimes they can modify the timing of medications to reduce the need to use the bathroom during the night. Stress is something that all of us experience. Stress is how your body responds to an event or situation. It is helpful to recognize various stressors in your life. These may include health concerns such as a new diagnosis of heart failure, chronic pain, or living with a number of health conditions. Conflicts in relationship and being isolated from friends and family can be stressors. Money worries and changes at work are also potential sources of stress. If you experience high levels of stress over long periods of time, this could lead to increased cholesterol, blood pressure, and risk of having a heart attack or stroke. Often in life, we can't remove stressors, but we can change how we react in various situations. Here are some strategies to help you. Physical responses to stress can include deep breathing, relaxation exercises, or going for a walk. Keeping a positive attitude is key to creating healthy mental responses and thought habits. Remind yourself to look at the good parts of a challenging situation. Emotional responses to stress can include anger, anxiety, and sadness. If possible, talk to a friend or family member to release your feelings and get another perspective. Behavioral responses include recognizing what you can and cannot control. Let go of things you are unable to change. If you can make changes such as modifying your work schedule or avoiding difficult people, take action to do this. At the same time, maintain healthy habits and spend time with family and friends. As a patient with heart failure, it is important to do what you can to optimize your quality of life. Take time for yourself. Read a book, go out with a friend, take a walk in the park to help brighten your day. Treat yourself to simple, healthy pleasures. Maintain a good attitude. Make a point of being grateful for positive things in your life. Cultivate your sense of humor. Take time to laugh. It is often said that we become like those closest to us. Surround yourself with people who nurture you. And always follow the recommendations made by your healthcare professionals. Overall, one of the most important things you can do is listen to your body. After all, you know yourself best. If something doesn't seem right, listening to your body can help you make choices that support your health and reduce stress.